Ventilator and basic medical device set. The basic device of technology-dependent patients receiving home life support is a mechanical ventilator. Household mechanical ventilators are portable devices with dimensions of 25 by 15 by 35 cm and a weight of 3 to 6 kg. They operate on electricity. However, most of them have internal batteries that last between 3 and 6 hours. For a ventilator to work properly, it's necessary to have a humidifier that keeps the oxygen moist and prevents the secretions from darkening. The hose set must be correctly connected and working. The oxygen concentrator and the oxygen cylinder are the oxygen sources used in the medical ventilation process. Oxygen concentrators are large, heavy equipment. They are generally welded, work with electricity, and are devices that purify the oxygen in the air through certain technological process and give it to the patient in a concentrated way. The oxygen concentrators must be below the patient's head level when operating. These devices are electrical devices. In cases such as power cuts, we can continue to give oxygen to the patient with an oxygen tube. Pulse oximeters are simple devices that can be worn preferably on the fingers or toes, showing the patient's current pulse, respiratory rate, and oxygen saturation in the blood. The value shown in blue and the device screen is the patient's saturation. That is the amount of oxygen in your blood. Shown in yellow is the patient's heart rate. Advanced pulse oximeters have waves that also indicate pulse pressure. There are portable fingertip pulse oximeters as well as stethoscope types. There are vital devices in the life support unit because it's the device that shows the clinical condition of the patient most accurately and quickly. It's normal for the saturation value to be in the range of 19.2 to 19.5 and above on the screen of the device and indicates that things are okay. The enteral feeding device, which is used in feeding patient, is used by connecting to feeding set. Enteral feeding pump sends food and water to the patient at the set amount and speed.